What causes shoulder pain and how can chiropractic help? Shoulder pain can be a complex little thing. So we can see shoulder pain coming from things like bursitis. Bursitis is where a little fluid-filled sac called the bursa gets irritated and inflamed. That is more of a chronic issue. So say, for example, someone that has a repetitive strain type issue with their shoulder, you can see it in sporting people. And that requires a little bit more work to do to actually try and calm down. Some of the helpers we have for that would be things like potentially a cortisone injection if it was really, really inflamed. And a patient would have that cortisone injection done, not by us, but by a specialist. And then that would help reduce the amount of inflammation while we would set to restore the function of the musculature and the tissue around that to help it calm down. Other shoulder problems we might see are rotator cuff injuries. That's another example of a bursa injury, but rotator cuff injuries are typically around the musculature around the shoulder. And we might see injuries to those again in sporting issues or injuries, lifting, and things around where the shoulder's put under a lot of load. So again, we'd look at that and try and restore the function to the shoulder and take the pressure off the muscles and tendons that are being irritated. Typically we might use cold laser or sometimes shockwave therapy around that. We would use manual mobilizations, some taping methods to help restore function through that. And we'd give the patient some rehab programs. Another thing that we typically see is frozen shoulder. So frozen shoulder is where we typically see adhesions laid down and around the shoulder capsule, and that can affect the rotator cuff muscles as well. You typically go through a freezing stage and then a thawing stage. So the patient would lose arm abduction and adduction. That can sometimes take quite a while to treat. Patients that we'd see with that sometimes can be from a trauma or injury. A lot of women get it as they approach menopause, and so again we try and work out a treatment solution to help with the function of the arm. And again, we'd be using kinesiotaping, cold laser, which doesn't hurt, and also some shockwave therapy, as well as mobilization and needling around that, just to try and help restore function and get the patient out of pain. So the typical treatment plan around a shoulder injury would depend on what the injury is from, whether it's a bursitis, whether it's a frozen shoulder, or whether it's a rotator cuff injury. Typically with shoulder injuries, they do take a little bit longer to heal than most things, but we aim to restore the function to get you better as quickly as we can. So typically you'd look at orthopedic tissue healing around 6 to 8 weeks with most acute shoulder injuries, and then chronic can take a little bit longer. But we employ a lot of different techniques, and that's something that we do at our clinic, which is a little bit of a point of difference. So we would use cold laser, sometimes shockwave in combination. We'd use kinesiotaping to help restore that function, and dry needling. So in the beginning phase, you'd be looking probably at around 6 weeks for treatment, but that can be brought forward or sometimes might take a little bit longer. But our aim is to obviously get you out of pain and get your shoulder functioning back to the way it was before the injury happened.